My client presents with that thing that we call a sacral torsion. And the only study I found on it was in 1988, demonstrating that those types of movements can occur. But I'm not here to debate whether it happens in the SI joint or doesn't. I'm just here to demonstrate that in this individual, if we create 4 quadrants on the sacrum, my left thumb is on the left lower quadrant, there is no mobility when I try to spring it forward. And on the right, there certainly is. And then above, so that we're on S1, there's mobility there and mobility there. PSIS is right here. All right, if we come underneath it, my left thumb is lower if I lift up. I'm allowing enough space for the sacrococcygeal joint. And I lift up, and her body accepts this movement. So movement translates through the SI joint and into other joints. On this side, movement does not translate through the left. I'm trying to lift it up, and I'm using, excuse me, I'm using even more force on that side. Anyway, a friend who sponsored, we're working together to promote these courses, and he asked me why I quit treating it with this technique, just capturing it with the palm of my hand and then just loading it for about a minute. I somehow became enamored with the corkscrew technique with the patient lying on their stomach. But we're going to test this method, and I'm going to push on that quadrant. I'm just pushing it straight anterior on the left sacral quadrant. And I'm also asking the question, can we accomplish a correction in less than 2 minutes? I've been kind of married to 2 minutes for a very long time. And I'm starting to ask, can we do it in less? Not a fan of doing it less than 30 seconds, but I'm willing to see what happens at 1 minute. So I just impart a constant pressure on the left lower quadrant of the sacrum. I don't worry about the side bending component. I just lean on it, and if I had a bathroom scale and could measure the force, it would be approximately 15 pounds of force. And I developed those skills many, many, many years ago using a device made by Medtronic, and the name escapes me at the moment, a force transducer measurement. Okay, so that's a minute there, and it feels symmetrical. And notice that I can load it, so the force goes through the joint, and when I spring it, we see the motion translating through her body. And now when I come underneath, those are level, and I can get some superior spring. So that's how I'm treating torsions. And please recall that sometimes you don't see them in upright sitting, and you have to have them bend forward. So bend forward slightly, lean on your hands. That's plenty right there. That's all you do. Make sure they're stable, leaning on their hands, and then sometimes it'll manifest. And hers did not return. I saw one in extension last year, only one. So that's very interesting. So go ahead and sit upright. If this person did not have a torsion in upright sitting, but they did when they forward bend, then what I would do, if I'm going to use the corkscrew method and treat it in prone, then I would put a pillow or two under their stomach to reproduce the lumbopelvic flexion, and then look for it, and invariably it would be there. But the main focus of this video is try pushing on the restricted quadrant, whichever one it is. And let's try a minute, then retest it. Thank you very much. All right, I gotta go plug in my phone. Do you have your phone handy? Good, because we'll use